the platelets, which are used in blood clotting, is the feature that we all know about platelets. But in addition to that, they carry growth factors that are released to help stimulate and promote the healing process. The vampire procedures are named for their use of the patient's own blood that we draw like a lab test, and then that's spun down to derive the platelet-rich plasma, which contains growth factors. This type of procedure, using platelet-rich plasma, has been used for many years, especially in wound healing, and now we're applying it to the space of aesthetic and cosmetic treatments. The vampire facelift is the first of these procedures to be trademarked. We're combining a filler like Juvederm as the first part of the procedure, and then that's followed by the use of this platelet-rich plasma. So we have the volume effect of the Juvederm in addition to the healing and regenerative and restorative properties of the growth factors from the platelets. The next procedure is the vampire facial, which is combining the growth factors from the platelet-rich plasma with microneedling. Microneedling is the use of what's called a micropen or a dermapen on the skin. The platelet-rich plasma is then absorbed through these little pinholes in the skin, which are not deep, and it's not painful to have this done. But this requires nothing to be done under the skin. The platelet-rich plasma is placed on top of the skin and soaks in from the top. So this is a procedure that can be repeated more often and has more of an effect on the surface of the skin rather than the tissue under the skin like the vampire facelift does. So we find that they're complementary. In addition to using the procedures that we have on the face, it's been now developed that using these growth factors in feminine areas to improve female sexual response and to treat urinary incontinence has been very successful. We have a companion treatment for men as well, which is a treatment for erectile dysfunction. For both the O shot and the Priapus shot, the effect is primarily a vascular effect. So in other words, new blood vessels and greater blood flow into the organs involved with the sexual response. It helps sex be more enjoyable.